Thank you, Dr. Neha Kakkar and Sahani sir. Good evening, good afternoon, and good morning. This is the 1695th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. SURJIT S. MAKKAR. Let us begin the session with 1 minute silent prayer.
Reflecting MAKKAR.
Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. And from 8:30 to 9:30, the international session in English. And from 9:30 to 10:30, a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who miss the session can watch it again. You can subscribe the same without paying any money. You can share it with your friends. And the purpose of this forum is to take homeopathy to every home around the world. And we hope all of you are sharing the videos, and we have just 6,500 subscribers now. Please try to bring your friends into this forum so that the viewers, the purpose of our forum will be achieved. The target of the forum will be achieved in that way also. And let me come to today's guest. As you all know, today our guest is Dr. SURJIT Singh MAKKAR. And Sir has presented so many sessions in this forum in both Hindi as well as in English, and has completed BVSc and H and MSc in IT, MCA, M.F. Homeopathy, Advanced Certificate in Artificial Intelligence for Digital Health and Imaging from IAISC Bangalore, and is a member faculty of Homeopathic Malaysia, DTS, that is Direct Trainer Skills, and former Joint Director, Punjab Veterinary Homeopathy Missionary, integrating holistic practice with the latest advancement of artificial intelligence in digital health and imaging. An internationally acclaimed consultant and researcher, and has done so many research in different subjects about homeopathy, artificial intelligence, as well as veterinary science. And today, so we'll be discussing about integrating artificial intelligence and homeopathy with the mitigating antimicrobial resistance, that is AMR. We proudly welcome the guest of the day, Dr. SURJIT Singh MAKKAR. Welcome, doctor. Please unmute, sir.
Thank you, sir. Our senior doctors. Thank you all the my seniors. So, should I share my screen?
Yes, sir. Yes, sir.
It's clear now?
Yes, it's visible and clear.
Okay. So dear friends, today we are going to discuss integrating artificial intelligence and homeopathy in mitigating AMR issue. As you know very well, in the world, especially in our India, what is happening, there's a lot of big issue of AMR because our economics of our country depends on the animals which produce milk animals, you can say, which produce milk. Okay, so these are small animals also and large animals also. Large animal section contains buffaloes. They are particularly North India, like Punjab, Haryana, Uttar Pradesh, and this Delhi, and like that. And there are more of the cows, that is in all over India. And the things have been taken by the HF breed, that is Holstein Friesian breed, which are producing high quantity of milk, not quality of milk. Because our humped cow, which is a desi cow, it is a only, you can say, this is a better and better, and it produces A2 milk. Okay, so now coming to the point, how this antimicrobial resistance is developing, because we are unnecessarily using antibiotics. That is the main issue. When we integrate this AI in homeopathy in large animals, so we come to know that there is no need of antibiotics. So as you know, this definition of MR is, so antibiotic resistance is the ability of bacteria, viruses, fungi, and parasite to resist the effects of medications that were designed to kill or weaken them. So this is the biggest problem growing in India, that AMR issue is going to develop. As you know very well, in the antibiotic section, there are already 7 generations of antibiotics. We start with the penicillins, that is first generation, and now we have the 7th generation. But after this, nowadays, there's no work going on the 8th generation. Only 7th generation's antibiotics are there. And now what is happening, our this bacteria and our fungi and our parasites and our viruses, they are becoming resistant to these antibiotics. And all the big institutions of our India, like AIMS and other institutions, they are starting using double, triple antibiotics. At a stat, at one time they are using 3 antibiotics. So this is the common scene in India. So how to mitigate this effect? With only with the concern when there's no need of antibiotics, why to give antibiotics? So that is the main point we are discussing over here. So when there's a alternative, homeopathy is not a big alternative. It is the only alternative, you can say like that. So if you say this is only alternative of antibiotics is homeopathy only. So if we come to know about this, how this AMR issue is developing, you see from this slide. So this is how this AMR issue is developing in everything, in pigs, in poultry, everywhere, in whatever we are eating, what we are taking. This contains all the antibiotics, and that leads to AMR issue. So why it is so? It is overuse and misuse of antibiotics. Environmental factors are there, and some limited new antibiotics development is there. Okay, so let's come to the main point, how we can resist this AMR issue. So these are causes: overuse and misuse of antibiotics. That's the main point. Environmental factors contributing to AMR, limited development of new antibiotics. I have already talked to you about that. Only there are 7 generations, and people are now using 2 to 3 antibiotics at one time. Okay, so this is how this antibiotic resistance is developing. So the need for the alternative treatment, yes, this is very important. Reducing reliance on antibiotics, lowering environmental impact, enhancing overall animal health through holistic practices. So this is how we can develop. This is a scene which we have developed with the AI. That's how this by holistic means we can develop this factor. We can reduce the antibiotic factor. So homeopathy approach principles like yours, like as you know very well, stimulating natural defenses. So there are a lot of remedies. In the coming slides, we will discuss all the things. So this is how we are giving this homeopathy to the animals. So this is a show. We treat every species of animals, right from sparrows to elephants, like horses also, dogs also, cats also. But our main concern is with the large animal section, that is cows, because there's a big, there's one most commonly disease that is developing. I'm audible to all people now?
Yes, sir. Everything fine.
It is okay now?
Okay, sir.
Okay. Thank you. So, so the big issue for there is a concern of the mastitis. So, maximum of the antibiotics used is in mastitis, but we cure the mastitis with homeopathy very well without using antibiotics. And you know the withdrawal period of the milk after we give the antibiotic, the withdrawal period of is 3 days. You are not supposed to take milk for 3 days, but who bothers in India? That is the biggest problem. That's why we are developing lot of issues like CKD, chronic kidney diseases, heart diseases, respiratory diseases. There are a lot of diseases we are developing only due to this factor. antibiotics, they are released in the milk and we are consuming that milk. Okay, that is the biggest problem going on. And the whole concern is why these antibiotics are available in the market. That's the main issue again. They are available on over the counter, OTC. Unless and until you stop the medicines, these antibiotics from the over the counter, how you can expect that antibiotic this AMR issue can be reduced? But motivating our farmers that homeopathy is a very good system of medicine, and by it gives very good results, and it is very economical. So we are motivating our farmers, and we are developing so many skills, and you can say that we are also successful in that case also. Okay, so integrating, enhancing diagnostic accuracy. So what we can do with the artificial intelligence, we can enhance the diagnostic accuracy, AI powered personalized homeopathic care. Yes, with the help of AI we can have the best of the homeopathic treatments, because it suggests from the patterns. So which potency we should give to the animal, which medicine and with which potency. I give you some examples in the coming slides, that how this AI has suggested us, you should not go for this 200 potency or 1M potency, and you should go for LM potency. And we have got best results with the LM potency. So this is how we have data-driven treatments, recommendations, and like that. So this is how the AI is going to help in our veterinary section, especially in veterinary homeopathy. So this is some of the herbs. Say this is antibiotic, you can say like that. So mastitis management is the main issue in our animals that reduces AMR issue. And best used medicines are Phytolacca, Brinia, Calcarea floor, sulfur, graphites. So we also treat these skin conditions like with sulfur and graphites, behavioral disorders with argentum nitricum and agnesia. When there is when the calf of a cow dies and it refuses to give the milk, so this means the animal is in shock position. In that case, when we give the agnesia 1M, this gives best results. And argentum nitricum we always use in case of mind symptoms. We take the mind symptoms into account, and that is prehension anxiety. Whenever there is a prehension anxiety in animals, we use this argentum nitricum. In the coming slides, I make you know how we are using this behavior. We are treating these behavior disorders with the homeopathy. So practical application is real-time health monitoring with AI, predictive modeling for selecting homeopathy remedies. This is very important, and we are applying these things. Predictive modeling for selecting homeopathy remedies, and we are successful in predicting the potency also, and we are predicting the this remedies also. Personalized treatment, we may make the machine learn through algorithms that are models. So this is how we are going with the homeopathic treatments, and with the help of AI, how we are making the diagnostics very successful, and ultimately we give the right medicine at the right time. So that we cover also the section. We find the similimium with the help of AI, and we find the right potency with the help of AI and machine learning. And that's how we are working. We are integrating AI and homeopathy. So this is some of the conditions we are using these homeopathy in respiratory conditions, UTI conditions, digestive issues. So in the coming slides, I will make you know all the things. As you know, there's no need to tell you about the principles of the veterinary homeopathy. So coming to the conditions where we can apply, yes, it has a same like minimal side effects and holistic approach and preventive potential, as you know very well all the things. So let's take some examples. So according to history, this is a Dr. Honingberger who has treated the Maharaja Ranjit Singh's horse. So that's why he becomes very potent. In 1829 and 30, he arrived in Punjab, you can say, where Maharaja Ranjit Singh was the ruler. So he treated his favorite horse. So that's how this veterinary homeopathy started in India. Okay. So coming to the main point, how we take the case, how we will take the veterinary case. So it's a respiratory. So, but every time we find what is unusual. Okay. So every time when we take the case, we find what is unusual going on. Okay. Then we find the LACM, that is location, etiology, concomitant, and modality. So modality is very, very important in animals. When the animals choose to do, we find every time location, etiology, what is the cause, concomitant. As you know very well, concomitants are the symptoms accompanying the main complaint without any pathological relation to the main complaint. So this is how we find LACM, and then we proceed, and then ultimately we find the PQRSU symptom, that is peculiar, cure, rare, strange, uncommon symptom. Every time we try to find. So this is how we take the veterinary case. So after finding the totality of the symptoms, we find the simillimum, and ultimately we applied that simillimum in case of animals. So this is a practical hints how we treat a case of mastitis, because this is a very, very important disease where the maximum of the antibiotics are used in mastitis. And to ultimately to reduce the effect of antibiotics, we can use this homeopathy medicines with very, very nice results. So whenever there is a blow to the udder, we always use arnica, and we have to find the cause. If there is an infection from the housing conditions or from flies, or there is a sudden change in weather, like if you know very well, if there is a sudden change in weather, we always give the preference to Dalkamara. And when these symptoms appearing in the udder or milk, then we have to apply this aconite also if the swelling is there, and if the milk turns something white type, then we give this. If there's any abscess, like we have to find all the things. We have to smell the milk also. Okay, what it is, smell, appearance, taste. So this is not a very easy job. You can say animals are not going to speak to you. I have a mastitis and treat me. No, we have to find. We have to observe. And during our 5.5 years, our degree of BVSc and AH, that is Bachelor of Veterinary Science and Animal Husbandry, we are supposed to observe the animal. We are made to learn how to observe our animal. That is the main thing in our animals. And the animals, they are giving symptoms so beautifully, if you observe them. So they are better and better than in giving symptoms, better than human beings, you can say like that. Because in case of human beings, they may lie, okay, but in our case, there's no point of lying altogether. In human beings, whatever they want to tell, they will tell you. And in our case, it is 100% natural. I'm audible now? It is okay? Hello?
Okay, sir. Everything fine. It's
Okay,
clear.
okay. I need sometimes note na कि I'm going right. Okay.
Okay, sir. Okay, sir.
Okay. Thank you. So every time we have to check how it is behavior changed. So dear friends, in case of humans also, in case of any living organism, whenever there is a fever or whenever there is a disease, so there is a change of the behavior. This is natural tendency. And if you say the animals, it doesn't change its behavior, no, it is not so. The animals give the symptoms. Ultimately, you can say like that. Animals give the symptoms very, very nicely. That's why homeopathy is very, very effective in case of birds also, in case of horses, in case of sheep and goats, in case of pigs, in case of wildlife, in case of elephants, in case of lions. So we have almost treated so many of cases of this all type of cases with homeopathy. It's successfully treated, you can say like that. So after finding the similium, we can start and we can find the tendency. So potency and doses, as you know very well, dear friends, till date in homeopathy, there's a problem of this potency. Everybody saying he's using this potency and that potency. Why are using that potency? There's no logic behind it. But with the coming of this artificial intelligence and machine learning, there is 100% logic. They give it logic. Why have given belladonna 30? Why have given belladonna 6? Why have given belladonna 1M? So this is the use of this artificial intelligence and machine learning in case of homeopathy, with the help of homeopathy, that is helping us with logic. Every time we find a logic. Why 200? Why 30? In other cases, when we give and other people ask why you given 30, why you given 200, they say it is not art. This is not art. This is science. We have to develop these science skills from these data-driven artificial intelligence techniques. So, dear friend, some of the constitutional remedies. So, this is how we take the case. Suppose this is arsenicum. We make the portraits in our mind. So, this is you see from here, fear of being alone. As you know very well, in arsenicum, what are the positions? It is very restlessness. It takes sips of water. It is very anxious. It is fearful. It is demanding. It is fussy. If there is any problem of cold, gastritis, diarrhea, food poisoning, so always there is arsenicum. I have make you teach all these maximum times these things. So let us case this is laxis. How this laxis, we make the portrait of laxis in our mind. You see the suspiciousness and it is treatments. So whenever there's a hemorrhages, whenever there's a circulatory disorders, whenever there's ovarian problems, and whenever there's a color of the skin is purple, laxis is the best and remedy, you can say like that. And suspiciousness is the most important thing in our animals, especially you see from the horse over here. So whenever you find a horse is watching you and in suspicious conditions, and whenever it finds time, it will kick you like anything. This is very, very suspiciousness. And we have treated so many cases only with suspiciousness in animals. They give the symptoms very beautifully, very, very beautifully, more than human beings. Because I have a lot of friends in human beings also. You, as you know very well, I have traveled a lot in international and national, and I talk to everybody, and they are saying symptoms you find in animals, they are extraordinary symptoms. So whenever you match them and whenever you find the simillimum, it is the best medicines. They work all together. Okay, so this is Nux vomica. This is most common used medicine in our animals. Every time over here, this tail is raised. This tail is raised every time in Nux vomica. So whenever there is ineffectual urging, know this point, ineffectual urging. So Nux vomica is the red. When there is a problem with the digestive system, don't touch me, nervous, oversensitive, irritable. So whenever there is a pain, colic, cramps, gastritis, ulcers, overindulgence, works after eating, it is a very chilly. So this is how we make the portrait of our remedy in our animals. Okay, we keep these things in our mind, and then we start treating our animals. So this is fast force. It needs always a center of attraction. Pulsatilla, very, very good medicine. It is very emotional, sweet-natured, gentle and timid, irresolute, wants safety, first, love and company, changeable. Yes, this is very, very important point. Emotions changeable, physical symptoms changeable. Even we have treated so many cases with pulsatilla only on the symptoms of changeable. changeable diarrhea. I have treated one recently. One treated one case of this horse, which has early in the morning the color is separate. In the noon, color is separate. In the afternoon, color is separate, and in the night, color is separate. 4 times I have seen the separate change in the colors of the diarrhea only, and this is noticed by the owner also. And on this symptom also, changeable symptoms, okay, changeable emotions, because emotions are changing. So that's why physical symptoms are changing. So that's why diarrhea is changing. So on that symptom, we have given pulsatilla, and we have treated that case very, very successfully. Within 2 days, I have treated that diarrhea in that case. CPR, very, very important thing. As you know very well, it is resentful, sluggish, exhausted, apathetic. It is very aggressive, irritable. Yes, very, very important symptom of the CPR. It always kicks its own offsprings. Very, very important. It never allows its own offsprings to suckle even. Okay. So any problem with the hormonal, painful seasons, irregular seasons, cysts and fibroids. These are the most common problems in our animals. Because in animals, our main aim is to reproduce the animals. Okay, and if we don't able to reproduce the animals, this means we are not we are not going to put a good solution to our farmers. Our farmers need only reproduction, and for reproduction there are a lot of issues like irregular seasons, cysts, fibroids. So we have treated so many cases with CPR only. So CPR is our main medicine in veterinary homeopathy. It rejects its offspring, miscarriages, like that. Silicea is again a very good medicine, like you know very well. It is a chili yielding sulfur. Yes. It is again a lazy, lacks perversion, sulks, peevish, self-centered, high intellect, aggravated by heat, dislikes being washed. This is the biggest skin remedy in animals. Yes, we are using it as a big skin remedy, and we are getting very, very good results. And ultimately, with the help of artificial intelligence, we come to know that whenever there's some aggravations in 30 potency, 1 minute, sir. 1 minute. मैं थोड़ी क्लास ले रहा हूँ 9:30 तक मैं 9:30 तक होना मेरी क्लास ले रहा हूँ 9:30 hello, it is okay?
Okay, sir. Okay, sir.
Let me have some water. So dear friends, let me, I have taken this case last time. Now I will take some other case, that is let's take this one case, whooping cough. Yes, this is very, very important case. Over here there is one dog which was presented to us with the she is advocate Shashi Ruhela from Uttarakhand, and she has reported that she has a 12-year dog, and it gets cough almost every year. He coughs continuously. His cough is dry, and at the end of chain of cough, he retches. He has given a lot of antibiotics and analgesics and medicines by veterinarians of modern medicine, but no relief at all. He is used to gut cough in the morning of the summers, but this time he started coughing in the beginning of May. With days, he has become emaciated also. During coughs, he vomits also. So now, dear friend, this is a history. Ultimately, they have taken the animal to the homeopath also, because she's a big advocate journal, okay, in Uttarakhand. So after taking to the homeopaths also, they give only the indicated medicines. Like you know very well what are the indication medicines, like Brania, like Drosra, like Spongia tosta. So all these medicines have been tried, even with the potency of 10 m also. One of the homeopaths in that area, he has given 10 m of the Brania also, but there is no improvement because he has not taken the history properly. So every time we have to take the history in a proper way. And if we take the history in a proper way and we take the LACM into account and we take the PQRSU symptoms into account, we take the constitution of the animal into account, we keep the mind symptoms of the animal into account, then we can find only the simillimum. And this is very, very important in homeopathy. As you know very well, you are all my seniors, as you know very well all the things. Okay, if we don't find the simillimum, no, we are not going to treat anything, whether it is any living organism. If you want to treat, every time, in every case, we have to find the simillimum. That's the main thing. So what is over here? What is the main problem over here? That my colleagues, they have not taken the history properly. Okay. So what he's saying, history now. I have again taken the history. Our pet is in a state of shock. Note this position. Laminating due to death of his close companion last year. Note this point. So we have been trained and we have been by our masters like Dr. S.M. Singh, like Dr. Frog Master, and these are all the people which I have traveled a lot, like Dr. Gupta from Lucknow and Dr. Kapil Sharma from UP. But these are all the people which have make me taught all the things, how to take a proper history. Okay, and we have to find every word. What is this? We have to observe every word, and we have to uh, calculate everything in a right time, at a right way. We have to take the proper history. Now we are taking proper history and we are finding every each and word. What is this owner of the pet is saying? Now she is saying, due to the death of his close companion last year. When he's saying the close companion of this animal has died last year, and his problems have arisen only from last year only. He remains confused most of the time and develops irritable nature. Note this point now. Otherwise, he was a warm, loving, and affectionate nature. So this is a laminating, okay, lamenting, not laminating, it is lamenting, is a PQRS symptom in this case. That is peculiar, queer, rare, strange, uncommon. So whenever, dear friends, whenever there is a companion of this pet has died, since then his cough has arisen a lot. He's continuous coughing now. Okay, he remains confused. He develops irritable nature. Note these things. So after taking this point, so these points are often overlooked by our conventional system of medicine, as you know very well. In allopathy, we don't consider these type of symptoms like lamenting. But over here, it is a PQRSU symptom. So it is main mind symptom. So means he's in a state of shock, lamenting due to death of his close companion last year. Since then, he remains confused most of the time and develops irritable nature with nervous, minute, gun-like cough. So this is a main rubric of the case. So, dear friends, this is what the patient. Sometime when we meet, I will show it is how it coughs. Okay, but it's not possible to make my video over here, and you can't listen the full sounds over here. Okay, so this is a dog. So what we have taken for the repetition, we have taken mind, shock, lamenting, confused, irritable. respiration arrested, cough during, respiration gasping, cough during, cough spasmodic, cough proximal short, cough minute gun short hacking, stomach vomiting, cough during, face discoloration, bluish during cough. Note this point again. Face discoloration, bluish during cough. Journals are food and drink sore. So this is friends how we take the case. So every time we take the case properly, we are going to get very, very good results. And if we don't take the case properly, no, we are not going to get good results. And ultimately, then people will say, no, homeopathy is not working. But you have not taken the case properly. You have not given the right medicine. You have not given the right potency. There are a lot of issues when we say like that, homeopathy is not working. But if we take the case properly, 100% this is going to be effective. And according to the 153 of ephemerism of organ of medicine, we always need striking symptoms. There's clear cut written in 153 of the ephemerism, and we are applying that ephemerism in our veterinary science properly. In every case, we try to find out the striking symptom, PQRS symptom, and we take the history with the point of LACM, that is location, etiology, concomitant, and modality. Then we can find only that after taking the totality of the symptoms, then we can find only the simillimum. That is a very, very important point. So in order to giving the blame to the homeopathy, no, homeopathy is working very well, very well. It never disappoints me. Yes, there are so many cases in which I have been got some disappointments, because now I feel with the help of artificial intelligence and machine learning, I have overcome those problems also. Because nowadays this I have trained my this LLMs, like large language models, into my way. With I have to feed a lot of veterinary homeopathy books to our LLM, that is large language models, and ultimately we are getting from patterns. It gives me very, very good results. It always gives me better solutions, like which potency should be given, okay, and where the dose should be given, how it can be repeated. Ultimately we should have the knowledge also. But if you say we are not totally dependent on the AI also, but we are taking the help of AI to find the simillimum, okay. So like earlier we are also using some this repetition tables also. We are using ultimately lot of things also, but with the help of AI and this ML machine learning, we are overcome some of this maximum of these problems. Ultimately we have come to know how to define the potency also, okay. So over here I have reproduced the case, since this is cases of many years ago. So over here we have taken 9 symptoms. We find 488 symptoms, okay, 4800 remedies over here. The first remedy which we have concurred is coral rubrum. Why coral rubrum? We have taken all these symptoms. We have taken all the rubrics. I have explained all the rubrics. So we have given the coral rubrum is number 1. It comes with the 27 points. Antim-tart is a 20 with 22 points. Veritum album with 22 points. Arsenic with 21. Sina with 20 marks. And coral rubrum has taken 9 symptoms altogether. And with antim-tart, only 8 symptoms. Veritum album, 7 symptoms. Arsenic album, 6 symptoms. With Sina, 6 symptoms. So these are the first 5 remedies. So we have gone with the cold rubrum, because cold rubrum is the most beautiful remedy, because it is found in the deepest part of the sea. Our case is our case of lungs, and lungs are deep seated in our body. So whatever there's a correlation of the remedy with the results also, with the site where the location of the organ also. So over here, the problem is in the lungs, and lungs are the deepest part of the body. And where the coral rubrum will act, it is found in the deepest part of the sea. Whenever there is a big sea, you can say like that. So whenever it is a coral rubrum, coral will be found only in the deepest part of the sea. So we make the correlations also. So this we have given this coral rubrum, and you see the results over here. Dear sir, cough of the dog has stopped almost completely. He coughs only or once slightly in a day. He has been given coralium 30 for 7 days as of today. This is the result after 7 days. So it is a great surprise to me for the wonderful result of coralium, that is coral rubrum. Since he is cured, so we recommend to stop the remedies and observe for 7 days more. And after 10 days, the owner reported that there is no cough at all now, and our pet is full energy and playing like before, with a big thanks to the homeopathy. So these are the words of his very, very senior advocate general of Uttarakhand. This case has given me a very good fame in India, because there are a lot of judges and a lot of people. They are after this hearing of this case, they reported to me, and I have treated. There are so many cases. So this is good, friends. Okay,
Yes, sir.
okay. You follow this case now.
Yes. Very well.
Okay. So I have to continue up to 9:30.
Yes, if you have time,
Yes,
you
yes.
go ahead, sir. You have cases. That's better.
Okay. So this is how after giving cold rubrum, and the animal is treated very well. And this is again a photograph sent by her. And sometimes I will show you the videos also. So this is ultimately owner words. Dear sir, cough of the dog has stopped almost completely. He coughs only once, that is very lightly in a day, and some days no cough at all. A big thanks to the homeopathy. So again, a case of a pelvic injury of a pup. This is again. Let's discuss some from the AMR issue point of view. Cases of this cattle. Yes, we take some cases of mastitis. Okay, so whenever you find these cases of cattle, like if they streaks of the blood, streaks of a red color over the udder area. This is the udder area which is very, very inflamed also over here. And there's a streaks of redness over there. So medicine is always there, belladonna and brania. We have ultimately cured these cases with belladonna and brania and articaurans. And if you say this case has been present to the allopathy people, they have given antibiotics, not 2 antibiotics, 3 antibiotics at a time. And the animal has been given antibiotic worth 5,000 rupees. And ultimately that milk has been consumed by our farmer. And that contains again a problem of the AMR issue, because it is withdrawal period of a antibiotic is 3 days, minimum 3 days. After you give the antibiotic, you are not supposed to consume the milk for 3 days. But in India, nobody bothers. And you don't know if the animal has been given antibiotic or not. So the only solution is homeopathy. And with the help of homeopathy, we treat the case without any problem. Quantity and quality of milk remain same. And ultimately, by giving this antibiotics, there's a quantity of the milk is also very less. Sometimes it reduces to 0 also. So this is again, you see over here udder. it contains a hard, stony. Whenever there is a stony hardness, over here, this is udder, which is totally inflamed. It is seen if it is going to be a burst. And when you touch this part, you find it is a stony hardness. And whenever there is a stony hardness, the medicine is conium mac. Wonderful results with conium mac and fatolac. So this is, dear friends, how we take the case. This is in veterinary side, and we treat the animals without using any antibiotic. Okay, that is why homeopathy is very, very economical. It is very useful, and it is serves not only the purpose of economics also, it serves the purpose of our health of our people. So nowadays, that is why there is a concept of one health is going on. One health means if the health of the animal is good, this means health of human being will be good. And if the health of the animal is not good, this means you are going to suffer. This is not a single solution. But we have to work together between health systems and this, because ultimately we are consuming the milk. Milk is the main constituent which you are consuming. That's why it is very, very important to stop these antibiotics without any. If they just use, you can use it. But over here, when there is swelling and whenever there is this stony hardness, how is this possible? Any antibiotic will going to work over here? No. Only homeopathy is that is like conium mac and this fatolac will work over here. So this is, you see over here also, this is acute mastitis case. Whenever there is a completely there is a swelling of the udder and there is a over a hardness is also there, and there is some redness is also there. So we use over here this branium, merxol, and like arsenic. Okay, and when we given, and ultimately you find this milk over here. You can see inside that. This is a ultimately milk which have been given on the first day, and after 4 days the milk is like this. So without using antibiotic, we have treated the case. Okay, so this is how we treat the case in field conditions, large animals. This you see from here. This is the first day, this is the third day, this is the fourth day. This is homeopathy, not allopathy over here. This is totally homeopathy with wonderful results. This to the animal, we give only the very, very small dose. We take the Hahnemannian fact, that is minimal dose. And what we are doing, we take only 10 globules of the medicine, we dissolve in 100 ml of the water, and whenever we give the medicine, we give succession, 5 times succession every time when we give the medicine. And out of that 100 ml, we give only 20 ml of the 10 ml or 20 ml of the if the animal is small, we give 10 ml. If the animal is large, we give 20 ml of the medicine. Only 10 globules into 100 ml of the water. So this is how this is very, very economical. It is very, very you're not supposed to give the drops on the to the animal. If the animal takes directly drops, you can give it on the nostril also. Then only 2 drops are sufficient. In case of elephants, we are also giving only 2 to 3 drops only in the nostril of the elephant. So this is how we give to the animals minimal dose. That is the law of Hahnemannian law, you can say like that. We take into account that law, minimal dose. That's why homeopathy is very, very economical in case of our animals. So this is again a coliform mastitis, as you see from here. This is the first day, and after 3 days, the milk has changed completely. Again, there's a lot of problems with the in the milk. Sometimes blood is there, and every time we have to check over here. In case of other system of medicine, we give only antibiotics. Okay, then we give some this blood clotters also, like vitamin K and like clostridium, like that. But over here, without using any antibiotics, without any using this anti-clogging agents, we give only the medicines like Epicac, and we consider these medicines not from the uh, we decide these animals these medicines from the color of the this blood in the milk. If it is a pink color, the medicine is millefolium. Medicine is Epica. If it is a dark blood, the medicine is phosphorus. You see the second case over here. See over here. It is a dark blood. The medicine is phosphorus. Over here, it is a pink color. The medicine is Epicac or Buffo. Okay. Over here again, you see the dark blood. It is phosphorus. Over here, it is a not too dark, but it is a something less dark. And over here, the medicine is okay. Now over here, you can see if there's a clots in the blood of the animal. Okay, over here, and the animal is taking food normally. And if the animal is taking food normally, and the color of these flax is somewhat like brownish, off-white, you can say like that, then the medicine is Calimeo, works wonders. But if the animal is off food, the color of the flax will change. Now you see over here, the color of the flax has also changed. Because the animal is now off feed, it is not taking anything. So the medicine over here will be Belladonna, Brani, and Articajonates, like that. So this is how we take the case, we treat the case, and we consider the case. So this is again some cases of deep teeth wound. Over here again, the excessive use of antibiotics. Every time people come and they give the antibiotics without any reason. Over here we have treated these cases with gunpowder, calendula mother tincture, 1:2 with coconut oil. We apply this coconut and calendula mother tincture with coconut oil in 1:2 ratio, and we give gunpowder 3x. Wonderful results with the gunpowder. We have treated so many cases of wounds only with gunpowder and calendula. In case of elephants also. Okay. So this is again a left foreteeth tip having a mass, not hard. Over here we have given acid nitricum and the case is clear. So this is again a problem of swelling of the teeth. We have treated with Lexis and calendula. Every time we take the case, we find the simillimum. That is the main thing. Okay. So again successful treated with the gunpowder and calendula mother tincture. And yes, this is very, very good. Pustules of teeth. Whenever there's a problem of the any pustules or any this on the teeth, best of the best medicine is Brolinum. It never fails. Never fails in my life. I have 40 years experience of treating these vesicles and cowpox with only Verolinum. Wonderful medicine. Okay. So, dear friends, again, vesicles are there. So, we can use with antimicrobial and Verolinum again. So, this is again the case of gangrenes. Sometimes gangrene develop on the tip of the cow, teats of the cow. We always give arsenicum and Crotalus horridus. Again, a wonderful medicine we use in animals, Crotalus horridus with mother calendula mother. Again, case of warts, we take this. So sometimes our people think Thusa is the only medicine. No, Thusa is not the only medicine. There are more than 50 medicines in the case of warts. So every time we have to take the case properly, and sometimes we have to give the carcinosin also. Over here, I have given the carcinosin, and after that, after taking the history, I know that I come to know that this is a case of carcinosin. So every time you have to take the history. If you don't take the history, no, you're not going to treat the animal. So, dear friends, I think I should end over here. This is lumpy skin disease. Yes, we have treated so many cases of lumpy skin disease with homeopathy. We successfully treated them, and with a lot of these medicines. So again, lumpy skin disease, you see here, this is lumpy skin disease total factor, and this is after treating the animal. So we have a lot of Gaushalas we have doctored in Rajasthan. we have treated. You see, there are a lot of persons of having lumpy skin disease and is cleared one. Okay, so this is how we are integrating AI and with the homeopathy in animals. So thank you, dear friends.
Yes, sir.
Sir,
Yes,
yeah.
sir. Thank you very much for what an excellent session indeed. Really, you thrilled us with the power of homeopathy, and you show the beauty of homeopathy with these cases. People believe that antibiotic is necessary, but you have shown that no antibiotic is necessary in such conditions. And whether
Yes, yeah.
if you choose the right remedy, right homeopathic medicine, it can bring out the best in the shortest possible time. That is the reason why you get such a wonderful case in the other side of the world. Congratulations once again. If anybody want to participate in discussion, I am inviting Dr. Bob Lim with a few words because the 3 minutes remain.
Yes, you mentioned my name, Dr. Dinesh.
Yes, yes, Dr. Bob Lim. Yes.
Problem? Yes, yeah.
You want me to say something or?
Yes.
Yes, sir.
Yeah, I thank you, Dr. Sujit Singh MAKKAR. You have done a very, very good presentation. In fact, it is awesome. It started with AI and homeopathy. I think you are one of the few veterinary homeopathic doctors who have really give a very good insight how homeopathy can help the animals uh, in the daily treatment, and also we can go for treatment free from antibiotics in animals. And you mentioned a lot of case taking, which is very, very good, and you've shared a lot of your useful, fruitful experiences in this webinar, and which is very, very beneficial for us, especially in mastitis. And I would like to say a very, very big thank you to you and my deepest appreciation for your sharing tonight. Thank you very much.
Thank you, Problem. Thank you so much. Thank you so much. Yes.
Yes, sir. Tomorrow we will have a session from Dr. Venugopal Reddy. He is a physician and behavior scientist from USA, and we'll be talking about don't give up and give in. So, thank you, Dr. Bob Lim, Dr. Sujit Makkar, and all others who attend the session. Hope all of you will be joining us tomorrow, and hope Sujit Makkar sir will definitely come to the platform for some more presentation as per your convenience later, sir.
Yes, sir. Sure. Sure, sir.
Yeah,
I will be always with you. Every time. Thank you, doctor.
Thank
Thank
you.
you, Dr. Sheila. Yes.
Thank you all. Good night.
Sir, every time our aim is to spread the homeopathy. Yes.
Yes, sir. Exactly.
Yes. Our main aim is to spread the homeopathy in the world, not
Yes.
India only, but in the world. Okay.
That's why our name itself says that it is International Forum for Promoting Homeopathy. So
Yes, yeah.
we don't bother about the person who comes here. We are ready to share everything to all, so that the people who does not know about all these things can understand what is happening with homeopathy around the world also.
Yes, yeah.
Okay.
Yes,
Thanks.
sir. Okay. Thank you, sir. So nice, sir. Thank you. Thank you, sir. Pranam, sir. Okay. Thank you.
Now it is time for Malayalam session. I am inviting Dr. P. Shaila to begin the session.